Do you
Mhm.
think that some aspects of our operational systems, the institutions in nursing, and even nurses themselves play a role in the diminished respect that we experience today? And if so, what is one thing that you would advise that we as a profession and as professionals do better?
It's a great question. And as I listen to it, even more so, there's not just one answer. I do believe there's several factors, including our healthcare systems, academia, other institutions, and nurses themselves, that play a role in the level of respect that we see today. I want to start by saying nursing is still a very much respected profession,
Yep.
but I think there is a lot of opportunity for us to grow that respect to greater heights. So if I start with the healthcare system, I think that over the years, nursing roles have become very heavily task oriented and productivity driven, right? It doesn't give nurses the time to really invest in their critical thinking because we're all about patient throughput, documentation speed, other
Yep.
types of efficiency measures, right? So nurses aren't really able to step back, like hone in on their critical thinking skills, some of this compassionate skills, even investing into their why. Why did they become a nurse? And so new nurses are coming in and they're just getting trained through the speed and not really able to leverage some of the things they learned in school. I think that's one thing. In academia, we're also seeing another type of disconnect where nursing programs, they work hard to prepare students, but we often see a gap between the trainings that they get and the realities of clinical practice, right? So a lot of times they'll enter the workforce and really underprepared for this fast-paced, very high-stakes environment that they encounter. In academia also, there's another layer to consider. We have this diverse pathways into entry for nursing. So you can be a nurse as a diploma nurse, associate nurse, bachelor's nurse, master's entry. That's been really helpful in helping us meet our workforce demands, right? Because we're like, anyone that can help, just help. We just need nurses. However, these diverse pathways, like unintentionally, are impacting how nurses are perceived and valued,
Absolutely.
right? Because based on your academic preparation, you show up differently at work.
Yes.
And then nurses, when we think about how we contribute to this, the reasons why we come into nursing have a lot to play here. So some people come into nursing because they really want to help. And some people come into nursing because this is a stable job with good benefits. And none of those reasons are wrong, honestly. But the differences in your why can influence how engaged you are. At the end of the day, we have to reclaim that narrative.